My name is Mariama Bojang, a registered nurse, currently working in the ICU unit in Edward Francis Multi-Gen Hospital in the Gambia. I was recommended by the FAB Foundation, First Lady of the Gambia. I'm currently in India studying ICU Nursing Training Fellowship. We have lots of challenges in the Gambia when it comes to patient care, especially in the specialty areas, like low resource income, low resources for us to take care of our patients, and we also have low training personnel to take care of our patients. And also we find it difficult with the technological advancement when it comes to today's world, like scanning units, the different advancement compared to what we have here in the India. So when it comes to specialty, we have lots of challenges, but I will just name a few. Things that we need in our country, especially the Gambia, will be the development. That's through the infrastructure of more hospital specialties, and also the human resources. That's through training of the specialty personnel, like the healthcare workers that are working in the different specialty units, so that it will help with improving our patient care, wherein they will have less patients to travel outside to be taken care of by other nationals. Merck Foundation Training Fellowship is important for me because it will help me with career development. That's my career goal. Because if I go through this training and I get back home, I will have more knowledge on how to take care of my patients. And also it's also patient empowering, because patients will have all the adequate needs that they have, like the staff personnel to take care of them. And also as a nation, we will develop more on all the things that if at least we have more personnel taking care of the patients, so we will have less and less needs comparing to employ other foreign personnel to come and take care of our patients. My expectation, as I mentioned earlier, would be personal development, career development goals, and also patients' empowerment through taking care of them, having all the knowledge needed in as much as possible, so that I'll be able to take care of them. Okay, I have lots of exposure when I came to Krishna University. We went through the various ICUs, like the neuro ICU, the medical ICU, the surgical ICU. And we are also exposed to different procedures like angioplasty, angiography, arterial blood gas measuring machines. We were able to do certain procedures in the stimulation labs, like CPR, different stuff. But I will mention the most that we learned a lot was about the ventilator, on the different modes, on how to take care of a patient and a ventilator, the different settings involved in them throughout the procedure. So we learned a lot during our stay. The training will help me a lot through, and my country as a nation, through training programs. Like when I get back, we'll organize some training on the certain different things that we learned during our stay here. So it will also help our patients, so that in as much as all the staffs, even if all the staffs are not trained in India, but we will be able to do some certain trainings when we get back to the country. So it will help with patients development, nurses development, as well as patients care. The study program will help me a lot, help us as a nation, not only me personally, because when I get back, we'll make sure we organize some training programs for our colleagues, that's our nurses, in as much as they will not be in India, but they will get the first-hand knowledge that we were able to gain during our stay. And it also will help us take care of our patients with the holistic care that they need during the process of their staying in the hospital. The advice that I would give to the newest aspirants coming in will be to always be focused on what you are here for. Try to get as much knowledge as you want during the process, because it's a short term, so you have to be focus oriented and always learn, always advise yourself, or you always be prepared to learn new things, and always be happy to interact with different colleagues, so that you'll be able to get all the knowledge that you need before you go back. My advice, or I would say, whenever you get to your wards, in as much as sometimes you get to experience some cultural difference, always be happy to learn something every day that you go to the clinical settings. And also make sure you learn from the culture, from the cultural aspect as well as the professional aspect, because all these things, you cannot take care of patients if you don't know their cultural background. So you try as much as possible to always learn from them and to always be open-minded, because you may have some cultural diversity, so it's going to be a bit difficult for you as you go along. So you can also be, as a student, when you come to the clinical setting, always be happy or always be ready to learn something, and never shy away from asking questions, because if you don't ask questions, you will not know what you are going to learn. So I think that one is the most that you should do when you get there. I would like to thank the First Lady for facilitating this the program through the Merck Foundation. A special thank you to Merck Foundation specifically for giving us this opportunity to be able to come to India to learn new stuff, learn new things to help our country, and also to Krishna University, because they have always been helpful through our process, the whole journey start to end. So I would like to say a big thank you to all that were involved in one way or the other during the process of us coming here, the Gambia.